failure. And she was given medication based on heart failure. And the explanation to her big stomach was the heart is failing. And that is why we have edema, swelling all over her body and her face, her legs, and huge, huge, huge abdomen because of the fact that the heart is failing. So when she came in, the first thing we looked at is what's inside that big stomach, and obviously was a lot of fluid. And when we looked at the liver, we find the liver very cirrhotic and very small. So obviously, the first thing that goes in my mind is a heart, is a liver failure, and liver, cirrhotic liver. The liver might be failing. Anyhow, we did the albumin level, and the albumin was low normal, so it was not very high. So, so that means we have to get rid of those fluids. That's another scenario of when the liver fails because of hepatitis. This is what we get. And this is the point of no return. We can no longer revive the liver back. Once the liver becomes cirrhotic, it is it. That is the end of it. The only alternative, or the only way we can go, is to do liver transplant at this point. And it's very difficult to do liver transplant. We require a donor, and we require matching between the two, and it's not done in Cameroon yet. So it is very easy to prevent going into liver cirrhosis by simply screening for hepatitis B and C. The most common here is hepatitis B, and I cannot stress it enough. I say, and I say over and over again, you must do the hepatitis B screen. So if there is positivity, then we can treat. If there is positive hepatitis B, then we can treat. The treatment is available and it works. And we had patients that had recovered hepatitis B. But we cannot give the treatment once you start liver cirrhosis. If the liver is already becoming cirrhotic, that means it's scars. Like when you cut yourself, you see scars. That is the same thing that's happened. Once the liver cell get infected with the virus and the virus bursts the cell is no longer functioning. It's just like a scar. Imagine now if the whole liver becomes like that, medication will not work. That is why it is essential for us, before we start the treatment for hepatitis, to scan the liver, make sure there is no liver cirrhosis, and that is the only way we can treat. I don't know if the video is available. We can see the lady. What happened? What can you tell me? What is the problem? How are you feeling? What is going on?
I feel bad.
You feel bad?
Yes, doctor.
Because of all these fluids inside?
Yes, doctor.
Okay, here we're doing an ultrasound. And again, this is a very cirrhotic liver here. The problem is not really the heart. I mean, I haven't checked the heart yet, but it's very obvious here. That's a cirrhotic liver. The liver, as you can see, is swimming in fluids. And the small size of the liver, that is by definition cirrhotic liver. So again, that's another case of complication of cirrhotic liver. The cause might be alcoholic cirrhosis, it might be hepatitis B cirrhosis, it might be hepatitis C cirrhosis. That's the ones we know so far in medicine. So that's definitely a case of abdominal ascites induced by cirrhotic liver. Finding out the cause is not going to help us much, because now we cannot revive the liver at this condition. We cannot revive it back. This is liver transplantation at this moment. And now the treatment will be just supportive. First, we'll take out the albumin level to see how much albumin we have, replace the albumin, and get rid of the ascites. And that's what it looks like. We have a lot of abdominal ascites. All right, welcome back. So we've seen how big is the stomach. Obviously, the lady is, she said she's feeling bad. She's under a lot of distress. You know, the diaphragm, which make us breathe, goes up and goes down to that abdominal cavity where a lot of fluid, limiting the movement of the diaphragm. So when the diaphragm cannot go freely all the way down because of those fluids, she cannot breathe well. That will reflect on her oxygenation. The saturation for the oxygen may be limited or may be decreased because of that inability to fully respirate, because of the limitation of the movement of the diaphragm up and down, because of all those fluids in the stomach. The minute we have fluids in the stomach, automatically I have to treat for something called a spontaneous bacterial peritonitis, meaning their bacteria already has accumulated inside those fluids, and that causes her a lot more stress. It's automatic. We do not know where the bacteria come from. There is a lot of explanation, theories where the bacteria come from inside the peritoneum, but it's automatically, the minute we see a lot of fluids in the abdomen, we must treat for specific bacteria that are already there. Coming from where, we have no idea. But she has to get the treatment for a spontaneous bacterial peritonitis, which means bacteria that cause inflammation of those lining of the abdomen. What is the second complication of those fluids? You know, we have also, most of the times, if not all the times, we have a right-sided heart failure. Right-sided heart failure. The heart will fail. Why the heart will fail? Well, we can explain that. We have the major vein that collect the blood from all over the body is inside the abdomen. And we said veins are thin wall versus arteries are thick wall. So inside that abdominal cavity, we have two vessels. We have the big vessels that feed everything in the body, which is the aorta. And then we have another vessels that collect blood from all over the body, which is the inferior vena cava. Since the inferior vena cava is thin walled, so those big amount of fluids will compress that vein, increasing the pressure on that inferior vena cava vein, which comes directly to the right side of the heart. So the increased pressure in the inferior vena cava that's in the abdomen now and is being compressed by all those fluids has increase in pressure, and that pressure will be automatically transmitted to the right side of the heart, and that contribute to the right-sided heart failure. Now, is it safe to give medication to increase the contractility of the heart in this condition? The answer is no, because she was prescribed something to increase the contractility of that heart, and the answer is no. Because when I force the heart to contract even more, the heart is already under stress, because when we squeeze that inferior vena cava by the presence of all those fluids inside the abdomen, I'm increasing the preload pressure. The preload meaning the venous pressure, the blood coming to the heart. I'm already increasing the pressure there. And also there is an increase in the afterload, which meaning after the heart, the artery are also a bit compressed, but since the walls of the arteries are much thicker than the veins, we don't have much increase in pressure that way. But we have venous pressure that has increased because of that compression, because of those fluids compressing those big veins inside the abdomen. So in this case, we definitely have right-sided heart failure. Right-sided heart failure. Now, the second thing is the bacterial peritonitis, spontaneous bacterial peritonitis. Those two conditions has to be eliminated. Now, for that specific lady, which she was told that she has a heart condition. She did not really have a heart condition. The heart condition is actually secondary to, because of the presence of all fluids in her abdomen. We get rid of the fluids, we get rid of the heart condition. So when we did hepatitis B and hepatitis C in this lady, we found out that both of them are positive. So we have both hepatitis B and C causing the liver cirrhosis. Liver cirrhosis meaning scarring of the liver. Now, we know that hepatitis B can lead to cirrhosis, and that cirrhosis can advance to hepatocellular carcinoma, cancer of the liver. So that is very sad. What are the choices for us right now? First, the lady is swelling all over. Face is swelling, leg swelling, hand swelling, and of course the big abdomen, the ascites that you see in front of you. So we have to eliminate those fluids. Before we eliminate those fluids, we have to test something called albumin, which is responsible for this ascites. When we tested her albumin, it was low normal. It was like 3.8 or so, and the lowest is supposed to be around that level, 3.8. So we say, okay, albumin is low normal, but she is, not keeping the fluid, the water that's supposed to be mixed with the red blood cells. She is not keeping those water inside the vessels. She is oozing out from her vessels inside the abdomen all this clear fluid, forming this big ascites. So in the next case, the next step in this lady is to add a bit more albumin to make sure the fluids will stay there, and try to make her feel a bit better by taking out some of those fluids. And giving some tablets, a specific medication to make her drain out all those fluids. Can we restore the liver at this point? We cannot. Nobody can. The only way is transplant. So she is late 50s, already get the complication of the liver, hepatitis, and there is no return. So now this is the second or third time we show hepatitis, different ages, different patients. So the message to you is, hepatitis B is a sexually transmitted disease. You get it from sex. My advice, if you have sex, both you and your partner should be checked. Before having sex, both you and your partner should be checked for hepatitis B. And I would like to add that hepatitis B, if someone has hepatitis B, is not necessarily transmitted to the sexual partner, because hepatitis B requires an envelope, to be covered with an envelope, in order to transmit from a man to a woman or a woman to a man. Meaning what? Meaning anybody we do hepatitis test for, and it come out that hepatitis B is for surface antigen positive, automatically have hepatitis. So anybody with hepatitis, we have the S antigen there. So if the S antigen is there, you automatically have hepatitis, but you're not necessarily transmitting the virus unless you have the E for envelope. The virus has to cover itself with a piece of membrane, we call it envelope, in order to transmit from one person to another. So if the E antigen is negative, you are not transmitting the virus. Now, there are some doctors will treat only if the E antigen is positive. And there are other school of doctors that treat anyway, as long as you have the S antigen. S antigen meaning surface antigen. Surface antigen meaning you have hepatitis. There is no doubt. I am the one for treat if you have the S antigen. Treat if you have the S antigen. Because yes, some of patients will recover hepatitis in their own without interference with medication. Some will not, and we have seen just few examples. How do you know which you belong to? Because if I go out there and get stressed, my immune system is dropped, the virus wins. See, it's a battle between the virus that try to multiply and make more viruses, and the liver regeneration capacity, which the liver renew itself all the times. It's a fight between the two. Your immune system drops, regeneration capacity drops, the virus wins. So in this case, the virus will become multiple hundreds of thousands, if not millions. Each one virus go inside one cell, multiply to thousands, and then the cell cannot accommodate them anymore. The cell bursts. And once the cell bursts, those newly released viruses will go attack new cells. And the story continues. Till one point, there is no, all the cells has been burst and become scars. And that's what we talk about liver cirrhosis. And this is, again, I'm repeating, this is the point of no return. You only have liver transplant as a choice to continue living. Meanwhile, we support you. You miss an albumin, we give you albumin. You're bleeding, we give you bleeding factors. We give you fresh blood, fresh frozen red blood cells, because those are the ones that's subject to attack. And also all the clotting factors. We give you all the clotting factors, except factor 8, of course, is not made in the liver. So all those, whatever the liver makes and cannot make anymore, we replace it, we give it to you. It happens that albumin is very expensive. It's 125, 130,000 for 20 grams of albumin. And you need like 4 or 5 of those every 3 months or so. So this is very expensive. And you will not be living comfortable. And the liver is a major detox organ in the body. It's the only detox organ in the body that can really take care of a lot of toxins in your body and is already gone. You're prone to toxicity at any given time. This is, if you have liver cirrhosis and if you have big abdomen like that, avoid any painkillers, any non-steroidal anti-inflammatories, anything that reduces inflammation you have to avoid. We have other medication that works as anti-inflammatories, but any non-steroidal anti-medication, especially paracetamol, you cannot take. What I'm saying is anything that causes liver injury, you cannot take anymore, because the liver is not functioning, and you do not want to insult the liver more. What is the second thing that you cannot take? Alcohol. Alcohol in itself causes hepatitis. So we cannot drink alcohol, not small, not occasional, not every time with my friends. You have a liver problem, you have hepatitis, even though if you have not advanced yet to the stage of cirrhosis, you cannot take alcohol, because alcohol causes hepatitis. There is a condition called alcoholic hepatitis. So we cannot take alcohol anytime you have a condition of hepatitis. And my advice, hepatitis is a silent disease. There is no symptoms till it gets really to the complication. And once we're in the complication, that's the point of no return, my friend. That's it. Okay, the next step is hepatocellular carcinoma, cancer of the liver that will extend and metastasize to all over the abdomen and possibly the lungs and the brain. So we do not want to wait. The solution is very easy. Hepatitis screening test, hepatitis B. Do hepatitis B screening test and see if you are negative. Confirm it one more time that you're still negative, and then take the vaccination. Vaccination is taken at 0, 1, and 6 months. And then relax. The vaccination will protect you for the next 10 years. Okay? So that is my advice to everybody out there. We're going to move to a new topic today after we take a small break, and then we'll talk about the kidney. 1 minute break, and we'll continue, inshallah.
Liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by Nsah just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities, In Boya, we are located at Malin Bomaka. In Vola, you can find us at Bonaberry, precisely at Entrepilot. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Today we're going to talk about the kidney. And the kidney, the most common thing in the kidney that people complain of is the kidney stones. So we need to know, how would the patient present? How would you feel like? What you complain of if you have kidney stone? The patient will come with flank, waist pain, that lasts sometimes for hours and then it goes off. We call it colic pain. It comes and goes. How would we explain the pains that comes and goes? If you have kidney stone and the stone has moved into the ureter, moved down to go to the bladder, it has to make it through a pipe called ureter. So when it moves through this pipe, of course, the stone has sharp edges, so it cuts as it goes down. And when it cuts the ureter as it's going down, it causes pain. Not only pain, you may also have a couple of inside the urine. So the urine will look a bit darker than normal, So we may find blood in the urine, and definitely you will complain about that waist pain, flank pain, right over the kidney where the stone is. So that is the kidney stone. What is the best way to find out if you have kidney stone or not? That will be the ultrasound, simple ultrasound. Everybody has them in his office. The doctors all have them in their office, the ultrasound machines. So that is the best thing to diagnose somebody with a kidney stone, is to use the ultrasound. We have an image, I think, of a stone in the ultrasound. We can play the image and we see. Well, actually, let's start with the first one. Yes, this is dilated calyx. Okay, the first image it shows a stone. The first one. Anyway, when we have a stone, see the kidney stone, as we can see, it goes. We have the cortex. This is one of the things of this picture here. We can explain on this picture. We have the kidney, as you see here in this image. We have the outer layer we call cortex, and that is the most important layer, really, because this is the one that does the filtering of the blood. And then we have those shapes that looks like pyramids. We call them the pyramids. And each pyramid lead to a space, we call it the calyx, okay? And as you can see in that first image, this narrowing, we have three major narrowing where the stone can get stuck. The first one, as you can see, where it says stones, this is the first place where the stone can get stuck. And if the stone gets stuck here and partially blocked the ureter, so the urine cannot go down, then we'll have dilation of that space that called the calyx, or the pelvis of the kidney, that will be dilated, and we can easily see it on ultrasound. Now, where is the second point? You see now in the second image, you see the lines there, those we call the ureters. Those are the pipes that connects the kidney to the urinary bladder. The urinary bladder is the reservoir where the urine collects, and then when you get the urge to urinate, when the bladder gets full, you get the urge to urinate and you go. And you see as the stone coming down, now the second image, as it's coming down through the ureter, it scratches off the ureter, and this is when you drop a couple of drops of blood inside the bladder, and you see your urine bloody or very dark urine because it has been mixed with blood. So this is where the blood is coming from. Now at the inlet of the bladder, there is another narrowing where the stone can get stuck there. The stone can get stuck there. See here. So that is the same. This is the passage of the stones, how they form the calyx of the kidney, and then they make its ureter down to the inlet of the bladder, the entry to the bladder, and then there is also an outlet of the bladder. So this is one of the narrowing. This is what you see here where the stone is exactly launched. This is the first narrowing that the stone can get stuck. The second is at the level of the urinary bladder. The third is at the outlet where that's it, the last sphincter. This is also when you can get stuck. Or be very easily seen with ultrasound without a problem. Now, if you have a stone in the ureter, you cannot see the stone in the kidneys, inside the calyx of the kidney, but instead you see dilation and a lot of accumulation of urine there. Then we know this, we have a condition called hydronephrosis. Hydronephrosis could be mild, could be severe, and hydronephrosis destroys the kidney. So that means I cannot allow you to stay with hydronephrosis for long. The kidney then will be damaged. And if the kidney is damaged, there is nothing to replace the kidney. And the kidney doesn't have the regeneration power like the liver. Once the kidney, small tissue of the kidney dies off and get damaged, there is no reverse. The alternative will be, you will go into dialysis, my friend. And dialysis, I don't want to talk to you about dialysis because it's hard that will do the kidney job 3 times in a week to detoxify and clear up your blood. That is the function of the kidney. The blood goes through the kidney many times in a day, and every time it goes, the kidney is like a shifter. It screens out the blood for all the bad things. I'm one of them. We had stones. I have to take them out. So now you're going to tell me, you have flank pain, you see few drops of blood in your urine, or you have flank pain without blood in the urine, you need to check for stones. It's a very easy test. It's done in 5 seconds. We can tell you have stones or you don't have stones. Not only that, we can tell you the stones are big, the stones are small. What is the difference? Up to 6 millimeters is easy to eliminate the stones. It's very easy to eliminate the stones. If you have tendency to form stones, then I will advise you, to drink citric acid, things that contain lemon. They call it in French citron, from citric acid, right? So this lemon, you squeeze 2 big lemons in your water every day. That will prevent you from having stones. In Europe, we used to say drink cranberry juice. There is no cranberry juice in Cameroon. But lemon will do the job. Oranges will do the job. Grapefruit will do the job. I like lemon. Squeeze lemon in your water, and that will prevent the stones from forming. Don't drink water without lemon. Will help you, especially in Douala. It's hot, and dry season is coming, and people are not drinking enough water. And that's a major contributing factor to form stones. Now you're going to ask me, how much water should I be drinking? Let me tell you first, how much water are you losing per day? Because whatever water you lose, you have to replenish, you have to replace. So if you are, let's say, losing 1 liter of water to the urine, and I'm going to take 1 liter to drink, that is not enough. Because you've forgotten something. You sweat, especially in Douala, and you sweat at least a liter, sometimes 1.5 liters a day through your skin. You may not notice, but believe me, you are sweating and you're losing water through your skin. So we're losing water through the skin to sweat. We're losing water to the urine by urination. And there is also another way that you're losing water that you don't realize. When you're breathing, when you let out like this, you are losing water. You don't believe me? Bring your phone and breathe like this and see. You see water accumulating on the screen. That is water. So you're losing water when you breathe also. And that adds to about 0.5 liter a day, at least. So we're losing 0.5 liter when we breathe. We're losing 1 liter when we urinate, at least. That's 1.5 already. And we're losing 1 liter when we sweat. And sometimes 1.5 liters to 2 if you're living in Douala. So that is how much? That is almost 3.5 liters a day. You're losing 3.5 liters a day. So if you don't replenish, if you don't replace those 3.5 liters per day, definitely you have high chance, to form stones. So my advice would be to avoid this. We drink water with lemon, not less than 3.5 liters a day, especially if you sweat in a hot area like Douala. Now, what if the stone, I always recommend before, when the stone is small, when I do the ultrasound and I found stones, I recommend, this parsley. Parsley is a green spice in the market, called parsley. You know it now. I don't know if I don't have a picture, but maybe Mr. Johnson if can help. Parsley, I forgot to bring a picture with me. Anyway, parsley, it's a spice in the market now. You buy for 200 francs, you get 1.5 liters of water, clean water, and then you boil them. You boil the spice, the parsley. And for 10 minutes. And then you drink. You add few squeeze of lemon, and you drink in the morning. If you have stones, they will be gone. They will go. Bavaria, the 0% alcohol, twice a day, will also help eliminate the stones. In addition to 3.5 to 4 liters of water a day. If the stone is small, it will be flushed out. Yeah, this is the parsley there. This is the parsley there. Yeah, that's it. That's exactly it. You take a bunch of this, you boil it, and when the water starts to boil, you wait 10 minutes, and then you drink the tea. You add lemon in the top of it, and you drink it on empty stomach every day, and that will eliminate the stones for you if they are small, less than 6 millimeters. Bavaria twice a day will also help. This is my recipe for patients with small stones. In addition to that, we have a small gum called Arabic gum and Frankincense gum. We mix them together, we make a tea out of them, and the patient drinks. And believe me, those combination of those two types of gums will restore the kidney function, even if the creatinine is up to 4. Above 4, we decrease it. But in this case, we have to refer to a nephrologist. So if your kidney function, creatinine, is high, we reduce it naturally with some types of gum and those combinations that I have told you for the stones. Now, we have to be very careful. I want to mention something. For that lady that I showed you the video for in the beginning, those patients usually die with those patients die with one complication called hepatorenal failure. Hepato means liver, renal means kidney. So the liver first fails, and then the kidney fails. Of course, I did urea creatinine for this lady, and was 1.75. 1.75, it seems like normal, but it is not. Because considering the age of that woman, we have to use a formula, log in the numbers that we obtain, and we find out that her GFR is not to even 30%, even though the creatinine was 1.75. So we're considering the age, and the weight of the patient. We have a formula that we use, and that will tell us exactly how much the kidney is functioning. So this lady definitely will be taking this types of gums that I use, and it really, really, really works. We have patients that were 4 creatinine, we drop them to 1.1, 1.2 normal value in 2 weeks. So this is something that I have just said. And also another thing, you go out there and you take herbs. And I mentioned this many sessions, and I still to stress it out. Those herbs, you don't know their effects on the kidney. I have young patients on dialysis. They already gone to dialysis because using herbs and using things that they have no idea what they are. If I'm gonna give you something, please investigate. What is this herb? What is the name of it? Oh, okay, let me Google it. Now we have technology, we can find out what I'm taking. Before you're taking it, do not accept something that is mixed and, okay, drink this and it's gonna be good for you. Believe me, I get even professors in university, people highly educated, still up till today, they believe and they take. Just because somebody told them it works. Where is your evidence? I have patients day and night saying, oh, I went to traditional medicine for hepatitis. Okay, let me see your hepatitis. Hepatitis is there, and the viral load is even increased. So deception is easy, but you should have enough brain to reject, because there is no evidence that this thing works. It has not worked. What you believed is a story that you were told. But does it really work? It doesn't. And I've seen it a million times. It doesn't work. It actually causes more harm than good. We're going to go back and talk about the kidney. So we've spoken about the hydronephrosis. Hydronephrosis is basically, I get the stone blocking the ureter, and then the kidney swells and accumulate a lot of fluids inside, a lot of urine inside. Urine is supposed to flow. We cannot keep the urine inside the kidney, because keeping the urine inside the kidney, now we are subject to infection, and we are compressing the pyramids of the kidney, compressing the cortex of the kidney, which is the functional area of the kidney, and whereby we will lose them. And once we lose the kidney function, we have a problem. We have a big problem. So the minute you feel flank pain, you run to the doctor and ask for a scan, an ultrasound scan. You do not. There's CT scan, and CT scan is very good when we need to put the exact location of the stones. But to know if you have a stone or don't have a stone, that is very easily done in few seconds with an ultrasound. I think we have an image for a stone and an ultrasound. We can show it. And if you do not see, if I'm a doctor and this is also a good image. Let me explain that image. We have the stone in, let's say, one of the 3 locations that we have told you about before, like at the beginning, at the calyces, at the entry to the ureter, inside the ureter, at the inlet of the urinary bladder, or at the outlet of the urinary bladder. What about if I cannot see the patient? Sometimes the patient has a lot of gases, and I cannot see really the ureter with the stone inside. So I look for evidence. If I cannot see the stone in the ureter because of a lot of gases, because that area is inside the abdomen, and the patient, most of the times, most of us with all the stuff we eat, we have a lot of gases inside the abdomen, and that limits my ability to see clearly the stone. I can see the stone if it's still in the kidney, but what if I don't see the stone in the kidney and the patient has flank pain? Then I'll go to the next step, which is this image here. This image shows the urinary jets. Jets meaning, it's like when the kidney empty the urine into the bladder, is like fire. It's like, with a hose, like with those water hose. That's exactly what it is. So if I put a color Doppler, which is a capacity in the ultrasound machine that allow me to see if the right kidney emptying in the bladder or not, I will see this kind of image. So this image here that looks like a fire flame there, that indicate that one kidney, I don't know, this is I think the right kidney is working fine. I'll do the same. I look also, I wait few seconds or fraction of a second, and then I will see another flame coming from the other side. That means both kidneys are working fine. Then the next step is to compare how much is this flame, how big is this flame compared to the other side flame, and I will know then if there is partial blockage, or if I don't see the jet, I don't see the urinary jet at all, I know there is a complete blockage in one side of the kidney. But I will also see dilation and accumulation of urine inside, and we can look to the next image where the kidneys are swelling and there is fluid inside. I don't know, Mr. Jensen, let me look here, I have my glasses. Yeah, this is a stone. This is, see this shining where the arrow is, this is a stone. This stone is small, it's about maybe 6 millimeters. So this one, we can easily flush it out with the parsley tea that I told you, with a couple of squeezes of lemon. Water that you drink always have lemon inside. You do not drink water without lemon, especially in Vola, and that will prevent forming stones. And Bavaria 0%, not the alcoholic one. The 0% Bavaria will help. This is another condition here that has to do with the kidney. And we have to differentiate really between a cyst in the kidney and hydronephrosis. This is for us to know which one is which. We're not going to bother you with this. This is just a cyst in the kidney. A cyst in the kidney also put stress. Yeah. And this is another condition when we do the ultrasound and we find some blood clots there. So somewhere you were bleeding inside, and then we find blood clot. We have to really be sure when we see that image that this is not a mass. So we shake the patient. Okay, patient, go to the right side, go to the left side, while my hand on the urinary bladder. And if this thing here moves as I'm moving the patient, it makes it blood clot. So then I have to insert the catheter and flush the urinary bladder out, break those big clots into smaller pieces and drain them out. That is very easily done. Now here we have dilated calyx. This is exactly what happened when we have a stone inside the ureter and the urine cannot go down to the bladder, so it accumulates up in the kidney and put pressure on the cortex of the kidney, and that damages my kidney. So this is here. Once we do not see a stone. You see here, you see in this image, we do not see the stone like we seen in the first image. That means the stone already has traveled down to the ureter, making its way back down to the bladder, and most of the time it gets stuck right there in the bladder. And when the kidney formulates the urine, when the kidney makes the urine cannot go down because of the obstruction of the stone. So I did not see the stone, but I seen evidence of the stone. So in this patient, I see this picture. I put the color Doppler on the urinary bladder. I will not be able to see the jets. I will not be able to see this kidney emptying into the bladder. Or if it does, it will be very small force, very small drops coming out of that kidney, and I compare it to the other side of kidney, if the other kidney is okay, and I can see clearly the difference. So in this image here, I didn't see the stone, but I seen evidence of the stone. And I confirmed it by the color Doppler when we did the urinary bladder. So in this case here, if the stone is big, and I give medication and I give the natural treatment that I have told you about, and the patient does not respond, then in this case we have to send the patient to something called CT scan, because we need to know the exact location of the stones now, and we need to intervene. There is a lot of good urologists in Cameroon. I'm aware of a lot of them here. So very easy, refer one of those patients to one of those urologists, and he will do cystoscope. He goes through the bladder, up to the bladder, and I forgot to bring a movie with me to show you how it's easily done, but it's very easily done. You go up, with a device like a scope, and it has a device, and it breaks the stone and then bring it down. And also, I'm aware of shock wave. They have it also in the Vola here. If the stone is too big, you go into a machine like a CT scan machine. You stay there, and then this machine will shock wave, meaning they will send strong waves into, will not affect your body, but it will break the stones, because your body is not made of stones. So this machine will be targeted only against the stones. It shakes the stones too hard with those waves, and it breaks them into pieces, and then you can urinate it out. It's a bit expensive. I heard it's about 600,000, but I am not sure. I sent few patients before, but I don't know if the price has dropped. So to avoid spending all this money and to avoid putting your kidneys at risk, follow the instruction. When you drink water, squeeze 2 lemons. Your water that you drink all the time, it tastes even better than regular water, and is nice and is healthy for you. Strengthen the immune system, prevent you from forming any stones. I think we are coming to the end of our session today. I hope you guys enjoyed it. You have a nice day. Today is the 1st of October. Happy National Day for Cameroon. I see you next Saturday. God bless you all, and thank you very much.
When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by Elisa just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. We are located in 2 cities. In Boya, we are located at mile 18 Bomaka. In Douala, you can find us at Bonaberry, precisely at Entrée Pilote. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.